All right. Good afternoon and welcome to our business meeting in regards to provider liable. I'm going to go through the meeting. The provider liable is the buzzword in healthcare. What is provider liable? Provider liable is defined by Medicare as services that cannot be billed to Medicare. A service that is related to inpatient services not medically necessary or reasonable. When the services are not medically necessary or reasonable, we call that a provider liable. Under Medicare, the case cannot be billed under Part B. However, the cost of the care outweighs the benefits. This is a problem that needs to be addressed and a plan put in place that makes it to be managed successfully.
What plan do you want to put in place to manage this?
I'm going to put the classical model in place, and that's how I've chosen to address the provider liable. The reason I chose this model is because it's the best decision making based on rational economic assumptions, and our management believes that it should be the ideal in making this. There are 4 assumptions that go along with this model that will assist in the strategy and planning for provider liable. The first assumption is the ability of the leader to define the problem and to set the goals out, and the goals are measurable. The first thing that will be dealt with is the provider liable. The customers are the case manager and later the patient. The stakeholders are the case management team, leadership, and the hospital system. So the goal is to have no provider liable every month.
What efforts are you providing to achieve this goal?
So how we're going to look at this first is we're going to educate the case managers about provider liable and opportunity days. This would be done by doing case studies of provider liable cases that we have or potential provider liables. Every month, a provider liable case would be done retrospectively to examine the potential areas for the case managers to step in and provide the education to the patient and to the doctor so that the provider liable would not ensue. By educating both groups, the potential for provider liable decreases. The second assumption is to gather information to make sure that everybody is well informed on the topic of provider liable. This is important because and it's an ongoing education, so it will continue to educate the case manager so we will not have this happen. The way that we're going to do this is the case managers every day will check the admitting orders for all the patients to make sure that they are correct, both in the computer system and on the chart. If there's a discrepancy with the admitting orders, then the Medicare process is put in place to correct that. A physician's order is of benefit to the inpatient, but it needs to be reviewed by the case manager and needs to be congruent with what is on the chart. If the patient does not meet inpatient criteria, then there are steps to ensue for that. The case management staff will be educated to check the orders every day, and they are taught to catch the orders